Continuing from the previous video, we will now review the other two pieces of evidence from Activity 2. Next, you look at some modeling results from CDC. These are national estimates, so not specific to your state. In this hypothetical scenario, CDC generated a stochastic compartmental model projecting cumulative hospitalizations for influenza in the upcoming season nationally. This model provided estimates of cumulative hospitalizations in 3 different scenarios. If influenza vaccine uptake is similar to last season, light blue line, if vaccine uptake is 20% higher than last season, dark blue line, or if it is 20% lower than last season, yellow line. For each scenario, 20 simulations are presented as faint lines. The bolded lines indicate the simulation for each scenario that possessed the median cumulative hospitalization rate. This model output is giving you some additional respiratory virus season information by showing potential influenza hospitalizations based on vaccine uptake from the previous season. You can see that in estimates with decreased vaccine uptake, the influenza season is earlier than when vaccine uptake is higher. You can use this model output in conjunction with local vaccine uptake data and with the previous COVID-19 scenario model to get a picture of the anticipated magnitude of hospitalizations due to respiratory illnesses in your state. Finally, you turn to a figure looking at RSV forecasts. This last figure is from a local online media outlet. It shows a projection of RSV hospitalizations through February. The model is an exponential growth projection based on extending the current growth rate of reported hospitalizations over the next 3 or 4 months and resultantly expects hospitalization levels up to 3 times the level of last season's peak, and extending well into February. You know from the earlier data slides that RSV tends to peak in late December or early January in your jurisdiction. With your knowledge of disease spread, it is also clear that any respiratory virus season projections that simply extrapolate a growth rate from early in the season, expecting consistent exponential growth over many months, are unlikely to occur. You also know that some media outlets may be more interested in conveying a narrative than carefully assessing all evidence to present a balanced view. Proceed with caution with this output. Going back to those 4 pieces of evidence, as the state epidemiologist, you critically reviewed these last outputs and noted their strengths, limitations, assumptions, and uncertainties. You know that none of these outputs will provide the complete, perfect answer to your Healthcare Coalition partners' staffing search question, but you have some reputable information that can help you provide an opinion. Based on your review and judgment, you would probably be most worried about a late December, early January combined hospitalization peak. It seems to be the usual timing for COVID-19 and RSV in your state, and a possible timing for influenza given the low vaccine uptake your epidemiologists reported. If we were in your shoes, we would be advising your Healthcare Coalition partners that surge staffing probably would be helpful, as overlapping peaks can cause significant healthcare demand, and December and January are the recommended months to employ surge staffing. This concludes Activity 2.